Hello, my name is Elia Castellan, and this is my case report on Andrea Sash. So, my character is Andrea Sash for the movie The Devil Wears Prada, which was released in 2006. Some background information on Andrea is she's from Connecticut. She studied journalism at Northwestern, and she really wanted to become a serious journalist, but she ended up as a assistant for the fashion magazine editor Miranda. Some cultural background for this film is the release date was in the 2000s, where the heroine chick was very popular. And another thing that's really stated in the film is a size 4 is ideal and a size 6 is considered larger. So my diagnosis is the psychological disorder, which is an eating disorder. People with eating disorders have a persistent and unhealthy thoughts and behaviors about food, which causes them to eat dangerously, such as eating too little or too much. Some cultural context that is important for the film is fear of getting fat, a relationship with food, and also the beauty standards. So here are some magazines that are from the 2000s where you see very skinny models and kind of show that glamorized skinniness. Some culture and diagnosis is that disordered eating is recognized in all countries, especially Western countries such as the United States. It also depends on the beauty standards for some countries. Some countries might glamorize fully figured women with curves, others not so much, which they might glamorize very skinny women. Another thing is that like there's a stigma around eating disorders. Only 20% of individuals with eating disorders receive some sort of treatment. So some symptoms that are shown in the film is individuals with anorexia nervosa might have a obsessive compulsive symptoms like breaking down food into smaller pieces. For example, in the film, Emily says to Andy or Andrea, I don't eat anything, and when I feel like I'm about to faint, I eat a cube of cheese. And so she's fasting, and then when she does feel a little bit weak, she knows that she has to eat something, so she'll ration out her food by eating a cube of cheese. Another thing in that's a symptom of an eating disorder is preoccupation with food and weight. For example, Emily also says, I'm just one stomach flew away from my goal weight. So that means she sees that some sort of illness as a way to counteract her eating disorder. Some symptoms that are not shown in the film are there's different types of anorexias or EDs. There's anorexia where it's like fasting, where you don't eat anything, or there's also like bulimia where like you'll eat but then you'll throw up so that you don't gain any of that food that you ate. There's also binge eating disorders, and many more. Um, on the DSM-5 criteria scale, some sh symptoms that are shown in the film are fear of gaining weight, body dysmorphia, also being extremely underweight, preoccupation with food and weight, fasting, and rationing. So my treatment and plan is a immediate medical and safety assessment if that patient is in critical condition and needs to be stabilized immediately. And then we start working on getting some psychological work done. So I would work with a registered dietitian that has eating disorder experience. Also, we would work on weight restoration, which reduces the medical risk and associates better with psychological and functional outcomes. Some other therapy that I would recommend is cognitive behavioral therapy, which targets disordered thoughts and maladaptive behaviors that maintain those eating disorder symptoms. I would also recommend interpersonal psychotherapy, which targets those interpersonal difficulties, like any personal thoughts about themselves that maintain those eating disorder symptoms. Why this plan is appropriate is because evidence shows that adults with AN respond better to multidisciplinary stepped care approaches that combine weight restoration with that specialized psychotherapy. Some ethical concerns is that patients with AN might refuse that weight restoration, and for severe cases, forcing any exclusive recovery or focused agenda might cause a dropout increase and worsen those therapeutic relationships. Some cultural barriers is, especially in this film, fashion and high appearance industries, fitness is rewarded and is normalized, and also eating problems are like seen as something that you might need therapy for, and that might come with some negative feedback. Some broader perspectives is that this film shows extreme dieting and pressure to be thin, which reflects real issues in the fashion industry, especially during the 2000s, where modeling was very high and magazines were very popular. And it also does not accurately show anorexia as a clinical disorder, which doesn't show any medical risk, as in like losing your period, losing your also losing hair, any other like medical symptoms of anorexia. Also doesn't show the emotional distress that comes with an eating disorder or any treatment for eating disorders. And it also used that these distorted behaviors as more of a humor aspect in the film, as something to be like laughed with. Some public understanding that might be seen from this film is that unhealthy behaviors are normal or glamorous, something to like look up to and something to do yourself. Another thing is that it may cause people to underestimate how serious anorexia nervosa is, because it can really affect your health and it can really affect your relationships and just your relationship with yourself personally. Another thing is that it shapes stereotypes about who can get eating disorders. It's not only just women, it can also be in men. It can also be in different ethnicities, different shapes, different sizes. It honestly can really happen to anybody. And it also shows an accurate portrayal. It doesn't show an accurate portrayal of how important it is to bring awareness and reduce the stigma. And it also kind of shows light into inaccurate um, portrayals of eating disorders that can be misleading and confuse the viewers. And thank you.